Psychopathology, Unit 1 Part 1 M.Sc, Psychology, Madurai Kamaraj University. Psychopathology definition. Psychopathology is the study of mental disorders and their origins, nature, and treatment. It is a broad field that encompasses a range of mental health conditions, including anxiety disorders, mood disorders, psychotic disorders, personality disorders, and more. The study of psychopathology is an important aspect of psychology and psychiatry, and it helps mental health professionals understand and treat mental disorders in individuals. History of psychopathology. The study of psychopathology has a long history, with roots dating back to ancient civilizations. In the past, mental illness was often thought to be caused by supernatural forces or a person's moral character. The ancient Greeks and Romans believed that mental illness was caused by the gods or by imbalances in the four bodily fluids, called humors: blood, phlegm, yellow bile, and black bile. During the Middle Ages, the Catholic Church played a significant role in the understanding and treatment of mental illness. People with mental disorders were often considered to be possessed by demons and were subjected to exorcisms or other forms of spiritual intervention. In the 19th and early 20th centuries, the field of psychology began to emerge as a separate discipline, and the study of psychopathology became more focused on understanding the psychological causes of mental illness. Sigmund Freud's theories of psychoanalysis, which emphasized the role of the unconscious mind and childhood experiences in the development of mental disorders, had a significant influence on the field. Today, the study of psychopathology is an important aspect of psychology and psychiatry, and it helps mental health professionals understand and treat mental disorders in individuals. It is a constantly evolving field, as new research and developments in the understanding of mental health continue to emerge. Psychosis and neurosis. Psychosis and neurosis are two different categories of mental disorders. Psychosis is a term used to describe a serious mental disorder characterized by a loss of contact with reality. People with psychosis may have hallucinations, seeing or hearing things that are not real, or delusions, false beliefs that are not based in reality. Psychosis is often associated with severe mental illnesses such as schizophrenia, but it can also occur as a result of substance abuse, medical conditions, or extreme stress. Neurosis, on the other hand, refers to a type of mental disorder characterized by anxiety, stress, and emotional conflict. Unlike psychosis, neurosis does not involve a loss of contact with reality. Instead, it is characterized by excessive worry, fear, or other negative emotions that disrupt a person's ability to function normally. Common examples of neurosis include anxiety disorders, phobias, and obsessive-compulsive disorder, OCD. It's important to note that these categories are not mutually exclusive, and some mental disorders may involve both psychotic and neurotic symptoms. Development of the Diagnostic and Statistical Manual, DSMV. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is a widely used classification system for mental disorders. It is published by the American Psychiatric Association, APA, and provides a common language and standard criteria for the diagnosis of mental disorders. The DSM is used by mental health professionals around the world, including psychologists, psychiatrists, and social workers. The first edition of the DSM was published in 1952 and contained only 106 disorders. Since then, the manual has undergone several revisions, with the latest edition being the DSM-5, published in 2013. The development of each edition of the DSM has involved extensive research, consultation with mental health professionals, and review of the scientific literature. One of the main goals of the DSM is to provide a standardized approach to the diagnosis of mental disorders. This allows for consistency in the way mental disorders are diagnosed and treated across different settings and helps ensure that people receive the appropriate care for their specific needs. The DSM-5 is organized into different categories of disorders, including mood disorders, anxiety disorders, psychotic disorders, and personality disorders, among others. It also includes diagnostic criteria for each disorder, which are used to determine if a person meets the criteria for a specific diagnosis. The DSM is not without controversy, and some have criticized it for its reliance on subjective judgments and its potential to pathologize normal human experiences. Despite these criticisms, the DSM remains an important tool in the field of mental health and is widely used to guide the diagnosis and treatment of mental disorders. Development of International Classification of Diseases, ICD-10. The International Classification of Diseases, ICD, is a standardized system for classifying and coding diseases and related health problems. It is published by the World Health Organization, WHO, and is used internationally to classify and report on diseases and other health conditions. The ICD has a long history, with the first version being published in 1893. Since then, the manual has undergone several revisions, with the latest edition being the ICD-10, published in 1992. The ICD-10 is organized into different chapters and categories, and it includes codes for a wide range of diseases and health conditions. One of the main goals of the ICD is to provide a standardized approach to the classification and coding of diseases and other health conditions. This allows for consistency in the way diseases are diagnosed and reported across different settings and helps ensure that people receive the appropriate care for their specific needs. The ICD is used by a variety of healthcare professionals, including doctors, nurses, and other healthcare providers, to diagnose and treat patients. It is also used for research purposes, to monitor trends in disease prevalence, and to track the effectiveness of public health interventions. The ICD is updated regularly to reflect advances in medical knowledge and to ensure that it remains a relevant and useful tool for healthcare professionals around the world. The WHO is currently working on the development of the ICD-11, which is expected to be released in 2022. Thanks for watching. By Sarvan Kumar Karunanidhi.